I wanted to take a couple minutes and talk about pain and different ways it comes about and different ways of treating it. Pain is a important thing. You need to know if there's something wrong with your body. You need to know if there's an injury happening, or if there's something that a sickness or an illness, and that's how your brain gets the information that something's wrong. So although pain is not usually pleasant, it's important that we have pain. Now, pain that lasts longer than, let's say, the amount of time that an injury is there, is a different story. There's plenty of people that have pain when there's really no good reason for it. You had an injury at some point in the past, and enough time has passed that injury should have healed, and yet the part of the body that was injured, or maybe it wasn't even injured, maybe you didn't really do anything, which is the case a lot of the times with low back pain. Once you start getting close to 40 years of age, you get scared of a sneeze, or you could blow out your back doing something stupid like twisting to pick something up, and then you're incapacitated. The amount of pain a person could get in with that kind of scenario is immense. That's the leading cause of people missing work in the country is back pain, and it's not because they have something terribly wrong with their back. When you do an MRI, for instance, oftentimes it doesn't show anything, which is good, but super frustrating because, I've had back pain and I know that it's debilitating. You can't go to work, you can't do the things you should be able to do, and there's really no good reason for it from an anatomical standpoint. Meaning there's not something we can say, all right, that's the problem, that's why you're having pain. Sometimes there is. Sometimes there's a disc bulge or a narrowing of the passageways where the nerves go, and that can cause severe problems. But in over half the cases, they actually looked at this. In over half the cases where somebody has back pain, there's nothing on the MRI to explain what's going on. So it could be a number of different things. When that's the case, and this could be true of any pain that's kind of lingering in your body longer than it should, after an acute injury, a couple things happen. So the way that your brain perceives pain changes, and the nerves that carry the information about the pain change. I've talked in other videos about the sympathetic and the parasympathetic nervous system, and basically those are the autonomic or automatic nervous systems in your body. Normally they regulate things like how much you sweat and how fast you're breathing and heart rate and how active your intestines are when you're digesting food. But that same system, or those same systems, usually the sympathetic side of it, can carry pain information as well. And so the brain perceives that pain as, in a similar way that it perceives other pain from, say, like a cut that you got today, or a hangnail, or a car accident. But that kind of pain doesn't respond to the things that usually help with acute pain. So there's a number of different things that we can do to kind of go after that kind of pain, whether it's different techniques, injections, or medications. That's something that sometimes we have to take a different approach to pain when it's been there for a long time. Going back to back pain, because that's a really common thing that we treat here at the clinic. I'm always trying to figure out where the pain's coming from. What is what we call the pain generator? Where does it hurt? And why does it hurt in any one specific spot? It can be muscles that are tight and spastic, and they are resistant to movement. Your low back is complex. There's a lot of muscles that are layered on top of each other. And then when you twist or bend, those muscles have to move across each other and interact with each other. And if one of those or several of those is tight, and even when your brain says relax, that muscle can't relax, then it hurts when you try to move it. So muscles that are tight are one thing that can cause that. Most people know this, but the nerves, they run in between the muscles, or they want to run on the surface of the muscle. And if you have a muscle that's locked up and the nerve is going over top of it, that nerve gets pinched between the muscle and the fascia. The fascia is the connective tissue, or kind of a tight but elastic tissue that rides on the surface and divides muscles. So when muscles are tight, nerves get pinched as well. Now sometimes it can just be that nerves are pinched because of whatever reason. It can be bone, it can be at the foramen, which is where the nerves come out of the spine. It can be actually further in. You can get something where your spinal cord it's too tight in the what's called the spinal canal, and that can cause pain or changes in the way that you feel different stimuli. A lot of times, however, the nerves are impinged or pinched in soft tissue, and that can be the classic one we see is sciatica pain. Now that can be from problems up in the spine, but more often than not, there's some muscles underneath, so deep to the glute muscle, that make your hip turn outward. And there's a group of muscles that attach to the outside of they go from your pelvis out to your femur, and they grab the back of your femur right by that big bone that's on the outside, and they rotate the hip back like that. Also stabilize it. But the sciatic nerve, which is pretty big, I mean, it's about the size of your finger, your small finger, or sometimes bigger. It's a pretty big nerve. It goes right underneath those muscles, or right past those muscles. And so that can grab on, if those muscles are tight or the fascia is stuck to the nerve, those muscles can grab on to that nerve and make it so that every time you try to bend your hip, or bend down, or sit in a chair, then those muscles are rigid and they push up against the nerve and cause pain. So that's another reason that people can get pain. Neuropathy is another problem where you've got bad information basically coming up through the nerves. And diabetes is kind of the leading cause of why people have neuropathy. We think it's because the signals in the nerves get messed up, kind of because there's too much sugar. It's a little too simplified to say that, but the nerve signals get confused, and so your brain is being told that there's either nothing there, so you get numbness, or that that your feet are on fire when they're obviously not. It also can manifest as problems with balance, because people don't know where their feet are, and so they don't trust themselves, or they don't go on to uneven surfaces or sand or whatever because they don't want to fall. So these are kind of different reasons that people have pain. We do a lot of things here at the Howe Clinic that can treat pain in general. If we have pinched nerves, I use a technique called Hydrodissection, which is effectively a very specific, it's an ultrasound-guided injection technique. And what we do with that is we open up space around nerves and break up adhesions, so that when the fluid gets reabsorbed, and the fluid is nothing special, it's some sugar water and some lidocaines, and sometimes we put some vitamins in there. But the idea is to break up adhesions so that sliding surfaces can be restored. So muscles, nerves, fascia, they can move in a more natural way and not pinch the nerve when you're moving your body. We use that when it's a pinched nerve type of setup. We also use that in conjunction with trigger points, because doing trigger point injections into muscles that are locked up. A lot of people are familiar with having knots in your shoulder. You can have knots anywhere, and you can't get those knots to relax. Your brain says relax, but the muscle doesn't relax. You're laying in bed, but this thing is rock hard as compared to its neighbors, or as compared to the other side, and that hurts because it just can't relax, and so the muscle's trying to release itself from the fascia or from whatever's around it, but just can't do it. So doing a trigger point injection, sometimes combined with hydrodissection, so we'll have a muscle belly that we go into and inject to release the spasm, but sometimes it's stuck then to the fascia as well, and so we can surround the muscle with fluid, and that helps the muscle to move more naturally. So those are some of the things that we can use for pinched nerves or spastic muscles. We have a fantastic masseuse here, very good at doing focused medical massage. So oftentimes I'll either send a patient to see her before the patient comes to see me, and she can kind of figure out what's going on with them in a broader sense and do massage to help relieve a lot of the tension. And then whatever's left over, then I can go back and do hydrodissection and clear out the rest of it. Or we can do it in reverse. It kind of depends on the way the patient presents, what would make the most sense. We also have an acupuncturist here who has been doing it for a long time. He's very good at using his skills to help people that are in pain or that are having sports injuries. There's a lot of things that acupuncture can do, but primarily what we use him here for is to help with pain conditions. So a combination of having hydrodissection, having massage, having acupuncture, and then we partner with trusted physical therapists and other movement professionals or sports like fitness professionals in the area to help get people moving and doing back doing what they want to do. Neuropathy, we've got a couple different things that we can use to treat the symptoms of neuropathy. The first thing we want to do is try to figure out why a person has it, because there are some reversible causes of neuropathy, and if we can address those, then a person's going to do a lot better from a symptom improvement standpoint. So I mentioned earlier that diabetes is a real good, or not good, it's the most common reason why a person would have neuropathy. Low levels of vitamin B12, too much alcohol, ongoing or in their past, chemotherapy, lead toxicity. Those are kind of the common ones that we see. There are other reasons to have it, and then sometimes people just have neuropathy and we don't know why. There's not a lot that can be done out there for neuropathy. So we've looked around and we've got a couple different modalities. Primarily, we use a microcurrent machine to help treat the symptoms. And this is a device that's sort of like a TENS unit, if you've ever seen that, but it's smarter than that. We can program it to do different things to target the nerves specifically, and we combine that with injections with little tiny needles. So it doesn't hurt, but it's I had it done on myself just to see, and it's not that big a deal. We inject lidocaine, we inject vitamins, we inject other things into the feet. At the same time, a person is getting these microcurrent treatments, and it doesn't work for everybody. It gives some relief, whether it's a lot of relief or a little bit of relief, to about 70% of people. So that's a lot better than being told this is just something you're going to have to deal with and live with for the rest of your life, to be able to improve symptoms. We don't usually get rid of all of the symptoms. Usually there's some residual symptoms after we do the treatment, but it's pretty common that we significantly improve people's pain from neuropathy or numbness or lack of balance from neuropathy. So that's kind of an overview of what we do for different types of pain here at the Howe Clinic. It's one of the most gratifying things that we do here. We do a lot of things that are pretty gratifying, but to be able to give a person back their birthright of having a body that works like it should and doesn't have constant pain is pretty fun. And it's what we do doesn't work every time, but we sure do what we can to help walk with the patient on the journey that they're on to try to improve how they're feeling in general. So it's a neat thing to be able to develop relationships with people and get them out of pain.